Good afternoon, everyone, and welcome to our next Impact series. We're just going to give it a minute to have everyone log in. So, just a minute and then we'll get started. Hey, I see the numbers slowing down. So, if you can advance to the next slide. All right. Good afternoon, everyone. Again, this is the first Impact series on healthcare access, one of our initiatives under the first goal. Next slide. And today, if you've been participating in other Impact series, the slide deck might look pretty familiar. We're going to go over what is the Impact Series, an overview of the RHTP, also known as the Rural Health Transformation Program overview, and then really set the tone of what is the focus of healthcare access and that initiative, and then we'll have a wrap up. This is an engaging conversation, so we really do look forward to you putting information into the chat, and then when we ask you to raise your hand so you can share your perspectives. Next slide. And with you today, we have two amazing facilitators. We have Dr. Ann Zink. She's an emergency medicine physician. She also has her own consulting business, and she's a professor with Yale School of Public Health. And we have Dr. Lisa Rabinowitz. She is another practicing emergency medicine physician, and she has her own consulting business. So they will be facilitating this conversation. And for those of you that don't know me, my name is Heidi Hedberg. I'm the Commissioner for the Department of Health. And so I'll pass it over to Dr. Rabinowitz.
Excellent. And thank you, Commissioner Hedberg and DOH team for creating this space. We're pretty excited to explore healthcare access today. You will find that both Dr. Zink and I feel pretty passionately about healthcare access, so we get excited about this. And really looking forward to envisioning what real impact could look like to our health systems in Alaska. And thanks to all of you for joining us. I know some of you have been to multiple of these impact sessions, so apologies as we're repeating some of this foundational material just so we're all on the same page. We really want to brainstorm together during this series, and part of that is finding ways to broaden our impact. Collaboration is the key, so I want everyone to really get involved, use the chat. Raise your hand. This is how we're going to have these exciting conversations. Please introduce yourself in the chat. And I can tell people have already been on these impact sessions. They're already introducing themselves. But put your name, your organization, what you're hoping to advance with this funding. And put your email, your phone number so people can connect both on the webinar and outside the webinar. And next slide, please. So there's lots of amazing resources that the Department of Health has kind of rolled out. They've tried to make it really transparent, and we encourage you to check out the website. It has a ton of great information, links to all kinds of additional information and resources. There's also office hours. These are really for technical assistance about the application process itself. Stay tuned for the in-person regional meetings. All these dates are being finalized right now. We're pretty excited to gather community input on the unique needs around Alaska and what is required for innovation in each region. And then, as you know, we're in these impact sessions. Those started last week. They're designed to explore 6 focus areas. Today, we are going to be talking about healthcare access, and tomorrow, talking about how do we show value for payment? How do we broaden our payment ideas so we can make things sustainable as we move forward with our innovative ideas to transform healthcare? And so we really want to use these impact sessions, as Commissioner Hedberg said, for big sky ideas. Let's think big. Let's find ways that we can come together. And next slide, please. So really these series, as I mentioned, are focused around six initiative areas. We really want to base these on state priorities, but also participant recommendations. So a lot of this is finding out what you need help on, what you need more expertise on, what can we work on together. So it's important to note that many of these will have a lot of crossover. Your organization may align with a few of them or all of them, and please feel free to attend as many of these impact sessions as you think align with your project. We'll use this time to kind of exchange ideas, lessons learned, including ideas from out of state and ideas that don't work, because we know there's a lot of value in that. And I think as we look at these sessions, we want to make sure you're getting what you need out of it, but also highlighting that both Dr. Zink and myself are not picking these projects. We have no role in deciding which ones are funded. So we really want to stay away from specific projects getting highlighted and really talk about, hey, how can we work together? If something's happening in Kodiak and we see a similar project in Fairbanks, how could those work together? What can we learn from each other? And next slide, please. What the sessions are about is connecting and really getting connections across stakeholders. We also saw a lot of interactions from tech vendors and expertise on the earlier session today around technology. And that's where you can build in expertise that you don't have already into your project and add that much more value to it. We also want to foster collaborative learning and information exchange, really building a shared vision for transformation where we all can figure out what's needed in our regions in Alaska, spark innovative thinking, and encourage participants to reimagine what this could look like. As I mentioned before, oftentimes that's when a project doesn't work. So we need to leave space to recalibrate and end up thinking about projects. We all have been in that situation. You can often learn a lot from that and come out on the other side with a even broader, better functioning project. And then we want to continue to identify and promote partnerships, and that is throughout Alaska. That's with expertise, as we talked about, but really finding a way to bring stakeholders together. And next slide. I'm going to turn it over to Dr. Zink now to kind of talk about the Rural Health Transformation Program.
Yeah, it's great to see everyone. And I would echo what Dr. Rubinowitz said. It's been fun to be. This is our fourth session now to see how organized you all are in the chat box right now with your names and contact information. Of note, we will be continuing to collect these, the Rural Department of Health is, and then being able to share them back out. And as we have further sessions, we'll have more kind of diving deeper into these specific topics. But again, to kind of round out our last two topics and thinking about the main six goals of Alaska, we wanted to kind of go big, high level again about what was the point of these funding? Like, what was it out? I was actually reviewing the actual legislation from the federal government earlier today, and it is this one-time funding that is $50 billion in federal statute. It calls out that there will be $1 billion allocated each year to catalyze rural healthcare delivery. And so there are specifics within the statute. CMS then takes that statute and helped to put out the grant. And then the Department of Health, kudos to them, had a very short time frame to say, what does this look like? Putting out a plan, and then was able to get $272 million allocated to the state of Alaska for 2026. That's the 1 year funding. You know, something we've talked about in other ones, every state got 100 million, and then how much additional money you got based on a whole series of criteria, including how good the application is and how rural the state is. And so, as you can note, 272 is quite a bit more than 100. And there's specifics that the state is looking at how to do that, which is part of why you all are here. Moving on to the next slide. This really emphasizes the last part that I had just mentioned. Typically, grants come out, and here's a 5-year grant, and you're going to go ahead and go do it each year and what you're going to do. This is a little bit different. The application that the state put in needs to be stuck with, However, each year, the federal government's looking at how well that went, kind of rescoring and reallocating money for the next year to go forward. And so we're trying to help partner you all as people both within Alaska or those looking to support Alaskans to think about what happens in year 1, 2, and 3. The reason these are called impact series is because at the end of 5 years, the goal is to have real, meaningful impact to Alaskans. Not every project is going to fit within the rural health transformation impact. There may be other ways in thinking about payment or modeling, but some of those things can kind of be built out of the conversations that are had here and other places. But I want to just re-emphasize this is a iterative process, and as Dr. Rabinowitz mentioned earlier, there will be opportunities to learn with each other as we go forward, rather than having to have the whole thing figured out at once. We cannot envision all of healthcare transformation in a 56-day application process. So that's why we look to you all to partner to really have meaningful impact for Alaskans at the end of the day. Going on to the next slide, you can see that how the state has really focused the vision specifically of it. I oftentimes would say when I was the chief medical officer, I loved the vision of the Department of Health and the health well-being and self-sufficiency of every Alaskan, but we really want to ground these in the vision for this set of funds. And that's ensuring that Alaskans have access to affordable care to stay healthy, with a big focus on prevention and primary care, which will fit really well into today's thinking about healthcare access, including mental health, specialty care, emergency, long-term services. So a lot of today's conversation, I think, is going to really highlight on that. And to get there, we have to figure out ways to reduce barriers to providers, to support our workforce, and the ways that we can use technology to help do that. And there was a lot of conversation on the earlier call about technology as we just wrapped up the Spark Innovation conversation. Moving over to the next slide. So as we kind of think forward, these are the major buckets that the state put forward. These major goals, goal 1, 2, and 3. I like to kind of think of them as how do we think about healthy communities, healthy beginnings, and healthcare access supported by paying for value, sustainable workforce, and sparking technology. And here in that blue box is where we're at today. So we already had one on healthy beginnings, healthy communities, strengthening workforce, sparking technology and innovation. Those are recorded so that you can go ahead and watch them if you want to. And today we're going to do a deeper dive into healthcare access. So moving on to the next slide, we will then transition into that topic specifically with Dr. Rabinowitz.
Perfect. So I think we're pretty excited, as I mentioned, to kind of talk about how we can transform and create bigger impact with healthcare access. And I think as we think about healthcare access, this is a big range of things. This can be on the community level, it can be on the regional level, it can be on the state level. We have a lot of opportunity for transformation around healthcare access. And if we move to the next slide. The state has thought a lot about this, and part of that application that Dr. Zink was mentioning, they prioritize this as one of the main focus areas for utilizing this fund. And this initiative really aims to expand and sustain essential health services across Alaska's road-connected and off-road communities where geography, severe weather, and workforce shortages limit timely, comprehensive care. I think everybody on this call can appreciate aspects of that. Really, these approaches are the framework that the state has lined out for funding. So increasing access to specialty care through the development of local provider capacity, telehealth, remote monitoring, and mobile specialist teams, strengthening hospital capacity, urgent care, acute and emergency care, trauma service, labor and delivery, maternity care, diagnostic, laboratory, and other ancillary services and therapies tailored to rural, remote, and frontier needs. Also, we need to keep in mind supporting seniors and individuals with intellectual and developmental disabilities so we can age in place and home and community-based services become part of that solution. And then aiding healing and transitions through post-acute and recovery care at home or in the community we've seen as one of those gaps that we still are trying to fix. And next slide. So I'm going to head back to Dr. Zink to kind of talk about where we're at right now with healthcare access around the state.
Yeah, thanks so much, Dr. Rabinowitz. And I did see Justin's comment in the chat box. We are collecting what's coming in the chat, so just wanted to highlight that. But there is a lot of things that are working really well, and we want to build on that and not take away from that. So, particularly within the tribal system, a real national leader in thinking about telehealth and providing access. We have a really different model in thinking about our rural healthcare, our rural hospitals, and kind of some of the financial sustainability around that. Our tribal partnership provides a really unique model that has really provided care in much of most of rural, frontier, and remote Alaska. And we have like unique provider types that are very different in this state. So I'm thinking about the chat program specifically, also the behavioral health aides, which is just very unique, very different compared to really any other state, separate from community health workers, different from, and really run within the tribal health system that is providing really great care across the state and in very remote and unique regions. But we know that there are also huge challenges in this. We've got a lot of different hospitals that have different services. We have very few, honestly, hospitals, particularly when you think about our geography. The way that payment tends to work is on a way that we consolidate patients or consolidate at a hospital system, and that's just not how Alaska works. So as a result, we see different services. We know a lot of people have to travel tremendous distance. I'll never forget talking to a family in Ketchikan and the time it took for them to wait to get the ferry to be able to get an ultrasound to see if they even had a blood clot. So what does that really look like? How do we figure out that access and redundancy when it needs to be in person versus telehealth? You know, Alaskans travel on average 150 miles one way to get access to care. When I share that with my colleagues in the lower 48, they're like, "Oh, I thought, a half a mile was a long distance." And it is if you've got to walk there tomorrow, but like, man, we've got some big distances and challenges. And I also think that that in some ways is our strength. But we also have really limited capacity. So, we have one NICU. I remember when I first moved up here, we had one trauma center. Those things have changed over time as we built, and this is a real opportunity for us to build on that together. There's things like eating disorders where we really have no facility kind of specializing in that. Things like long-term care services and aging in place and aging at home, very different when you've got a huge nursing home versus you are having an elder stay in community and what sort of services. Again, this is very focused on what makes sense for Alaskans for healthcare access and service. And that means we got to figure out the workforce gaps and other challenges are there. So as you're thinking about this, and as you're thinking about answering your questions, as we're going to start to engage you all here soon, really asking you to think about what are the strengths and challenges we need to consider for Alaskans. We've been kind of, in general, calling kind of on Alaskans to kind of highlight where they think as we go through some vignettes coming up here. But really, I think when I think about that healthcare access, we're bigger than Texas, California, Montana combined with more coastline than the West Coast and East Coast combined. We got some huge distance challenges that make us to come up with unique solutions. Let's go on to the next slide. This is where I start to like to get into the fun of it. There's a bunch of different things that we can put up here. These are things that the state has thought about, but that you have also highlighted as ways that we could use healthcare access funds. So investments in things like primary care and behavioral health, maybe outside of what's happening in the workforce or in partnership of what might be happening in a workforce. It's not like people can just apply or have to apply to one of these things, but we're trying to meet all six of these goals kind of at the same time. Pharmacy, direct access to services. There was some stuff that came up on the last call. I just talked about senior supports. There's been some great conversation in these calls about EMS, care coordination, great work happening in Alaska. I think about the mobile integrated teams, the work that's happening in Fairbanks and Matsu and Juneau and Anchorage, all slightly differently about thinking about how to get people care where they're at rather than asking people to always come in. And that really also then leads into these home and community-based residential services, skilled services, serving those with disabilities, thinking about transportation networks, and again, thinking about how do we turn this patient-centric. So we're going to go ahead and switch over to the next slide, which then starts to engage you all. So as we've talked about on the other calls, this is kind of an overview on this topic. And then future calls, we're going to dive deeper into a specific topic. And we're asking you all for your input on what matters for that. What do you want to dive into? So go ahead and launch a poll here. And in that poll, you get to rank if you think something is a high priority, not a priority at all, or somewhat a priority. So you can go through behavioral health services, oral health, specialty. What do you really think Alaskans need to have really have the biggest impact for the rural health transformation dollars to make sure that we are putting our time and effort to have the biggest impact on this? So go ahead and take a moment, read through those, reflect. Embrace the challenge that the state and the committee is going to have in sorting through all of the amazing proposals that are coming in and they're going to have to figure out how to fit those in there. But also, this helps to help them see where you all are putting priorities and moving forward. That will help to inform the conversation. This is a dialogue. That's what I've always loved about Alaskans is we're one community figuring out solutions together. So this is you getting to rank and say what's important to you all. So once it starts to slow down on the polling, if you just joined, please rank in the priority list. If you think this is each one of these topics is somewhat a priority, extremely high, or not a priority at all. It looks like our responses are still steadily rolling in. I'm bad at silence, so I keep talking so you guys get a chance to put it in. And when the responses start to slow down, then the amazing team on the back end is going to go ahead and release the poll so that we can see it. And if there's something else that you don't see in here, feel free to put it in the chat bot. And I'm seeing a couple people just say in the chat, like this is like their number one priority or number two priority. Again, in an effort to collect the data information to that poll, but if there's something that's not fitting, that's okay too. Okay, here we go. So that light blue is not a priority at all, and the bright orange is an extreme priority or a really big priority. So we see things like transportation to rural and remote care comes up, but man, a ton on the behavioral health, certain crisis services. Seeing some on the integration of physical and behavioral health, mobile integrated health, and the ways that moves forward. See less so on Indigenous health, but kind of a third, a third, a third in there. A lot on the care coordination. I would say that and behavioral health are kind of towards the lowest, maybe also specialty access, the lowest of like not needed at all. Um, a couple comments in the chat box that I just wanted to highlight, substance abuse. I guess like we had thought about that and the behavioral health, but clearly they're different. So appreciate that. I also just appreciate the call out on like primary care, not specifically being included in the healthcare access. And I think that that's a great point. There's also work happening with the Division of Insurance on that space. And so lifting up the many comments on that have been on there because that was not intentional in any way. It was to leave that out, but to include that overall. Okay, so those are what we're kind of seeing from the space. I really appreciate people's chat and back over to you, Dr. Rabinowitz.
And go ahead and advance to the next slide. So we're going to look at a vignette, and this is Violet. And Violet is a behavioral health provider based in Kotzebue, supporting patients in surrounding Northwest Arctic villages such as Noatak and Kayana. Violet can't be everywhere at once, and for many patients, access to behavioral health care is limited and inconsistent. Most villages don't have local behavioral health providers, and Violet's patients often must travel to Kotzebue or wait for infrequent visiting services to receive care. Weather delays, high travel costs, and time away from family and work make it difficult to attend appointments, particularly for youth and caregivers. Telebehavioral health is limited, and behavioral health services are not routinely integrated with the primary care, resulting in a fragmented care and missed opportunities for early identification and follow-up, especially for individuals managing both behavioral health needs and chronic medical conditions. So I think those of you who are providing medical care in remote Alaska, this is feels very aligned with what you experience. I think the comments about primary care, I think the reason that probably wasn't on that survey is that we assume that primary care is our baseline for providing access and expanding healthcare access around the state. So that really is the framework that the whole system is based on, and everything needs to coordinate through that. And all of these mobile integrated care, this is all going through this primary access. Yes, we need to integrate specialty care, but how do we support those primary providers caring for our rural Alaskans? So if we can go to the next slide, and then I want to really encourage people to raise your hand. Let's get some comments going both in the chat, but I'd love to hear from people. So raise your hand. We can invite you to come off mute and share a little bit more about what you're experiencing, what projects you can see that would help transform a system in Alaska. We really want to make it so Violet's patients have access to the care they need. What would be different for Violet? How do the care providers need more support? How do the patients need more support? And then the community as well. How can we improve access for everyone in that community? Um, so there are a couple great comments in the chat, and Dr. Zink, you can chime in as well, but really seeing more about that kind of primary care and then behavioral health and substance abuse, similar to our poll. How do we improve behavioral health and substance abuse throughout the state? I know there's lots of efforts already ongoing, but I'd love to see some ideas start to populate the chat, some more specific ideas on how we can kind of get this going. And I'll turn it over to you, Dr. Zink, to highlight a few more things in the chat.
Yeah, and to the team, feel free to also raise your hand that Dr. Rabinowitz will be calling on people if you want to share something kind of out there again, looking at how do we solve Violet's challenges. I just would highlight, there's, Kelly had mentioned like, how do you empower a patient to have like their own medical records and their healthcare access versus then the other way is like getting healthcare access out there to that individual person. There's comment about regional behavioral health facility. We chose a topic that was a little bit more challenging in some of the data needs, because sometimes behavioral health data is really isolated from primary care data, or a behavioral health provider in a small region may be the cousin of the person who needs help. So what are the kind of privacy issues that we really need to take into a consideration when we're kind of expanding? I also want to highlight there's some questions about broadband and internet availability. These funds cannot be used specifically to do that. So there is efforts ongoing to increase broadband accessibility. So I think we take where we're at and then think about where the future is going. There was a lot of this conversation in the Sparking Technology conversation that we had earlier today about what's moving fast in the technology, AI, broadband space. So I would say that the project is meant to meet the reality of Alaska and Alaska's rapidly changing infrastructure as we're all trying to find impact in as many ways as we can. So back over to you, Dr. Rabinowitz.
Perfect. And I'm going to call on Jonathan Strong, who had some comments this morning. And I believe, Jonathan, you're calling in from Kodiak. So go ahead.
I'm unmuted. Can you hear me?
Yes.
Okay, yeah, calling in from Kodiak. To help Violet, I was the Kodiak Area Native Association, our local tribal healthcare system. They have something called Island Strong. It's like peer support for behavioral health, and I was able to go out with them one time to one of our villages and do peer level support for behavioral health, and that peer level support I think is great. Uh, what I'm doing though, I think if it's professionalized, providing the tools and the things, and even the financial support, because our workforce in remote areas, we got to have ways to pay the people that are actually doing the stuff, and give them the tools they need to do a professional job. So I think peer level support and workforce stuff with transportation built in, to that, it will be helpful for Violet and her patients.
That's great. I think those are some great comments. I think you touched on showing value for the work you do, which we'll kind of talk about that with payment models tomorrow, but also having some guidelines and keeping professional standards and supporting our workforce so they're have the knowledge base behind them to provide good care. Um, as we promote and expand access in rural Alaska, we want to make sure we're providing the best quality healthcare to Alaskans. So I think those are great comments.
Some of
I
the
would
things I
love
would
to,
mention. Oh,
yeah,
sorry, go
go
ahead.
for it.
There's a lot of great comments in chat about workforce and wanted to kind of elevate that. But I also wanted to just pull out the comment that I think it was Jennifer. I saw it moving fast here, but like I think we think a lot of our system in terms of like, how do we take a patient and escalate the care when they need it, be a trauma service or a behavioral health, and being able to, how do we keep patients in there? But I also want to just have us keep thinking about how we de-escalate care. So a patient just got released from prison and need to get back into their community. A patient got released from API and they need to go back. A patient got released from a nursing home after a hip fracture and goes back. So I want us to continue to push not only to like, what do we need in community? How do we escalate care? And how do we de-escalate it to get people back to community in different ways? So kind of another way to frame it, which I'm seeing some of that in the chat box and I just wanted to highlight. Sorry, back to you, Dr. Rubinowitz.
No, I think that's great. I think as we think about those transitions, we have post hospital care that we need to address. There's a definite shortage of those beds for people that don't require acute hospital care, but aren't quite ready to go back to their community and need that higher level of nursing care. Same thing on the other end as care escalates. Maybe they don't need an acute hospitalization, but more support in the community. So how do we build that in? I think there's a lot of comments in the chat on coordinating care, and I think a lot of that starts with coordinating care and that, being able to look at the medical records across there. We see some HIE comments in there. Dr. Doty is mentioning that. I think we also need to rely on our mobile integrated care using some of these outreach like Jonathan Strong was mentioning, so we can support all the providers and try to de-escalate care, as Dr. Zink was mentioning. There was someone, let me come back to this, that was talking about Iceland and doing primary prevention, and I think we can't forget about that. Here it is, Katie Cornwell, modeling for reducing substance abuse and treatments, working on the front end of that as well, and changing the environment, focusing on primary prevention is also part of healthcare access. So I do think, we need to think broadly as we think about healthcare access. And I'll throw it back to you, Dr. Zink, to pull a few more things out of this chat.
Yeah, no, I appreciate it. And I think, I wanted to actually, I was going to type you, Lisa, but I guess I'll just speak it because I can't do both at the same time. But like a great example she brought up was what the Muni is doing with kind of the policing work. But like, how do we then leverage that with what Matsu is doing with HUMS, what Fairbanks is doing with their EMS, what Juno is doing with their MVP program? They're all slightly differently paid for, structured, using technology and services. How can we learn from each other in this space? Or I think about other organizations that are on this call who do complex care navigation and what Justin was just mentioning in Kodiak. Like, I think there's so many similarities between that and so much great work that's happening that if we can kind of streamline these and elevate them and take learning from each other, and that's where I'm hoping that in our future sessions we'll be able to move forward. Also raising up like Barb Doty's comment about like community connections and building up with Matsu. I do want to highlight, like, if we can build on things that already exist, like that makes things faster, either experiences and or structures that are already there. Like Medicaid has a peer-to-peer service that is paid for. Like, how can we use that to be able to, I think about True North Recovery, being able to extend out services to make sure healthcare access for SUD is able to be done. But then also like what things are needed to be able to, where are those gaps and can these funds be really used to address the gaps? The last thing I would just highlight is like, this project won't solve all problems. So I see other legislative suggestion, taxing suggestion, other things, and always great to have ideas there. But like these will be in general focused on what these funds can be done and can do to move forward overall. So just wanted to kind of highlight that. But back to you, Dr. Rabinowitz.
Perfect. And I see some interesting things in the chat talking about pop-up clinics. So keeping kind of hybrid ideas out there where we use a central hub like the school or gym in these smaller communities. How do we tie in the schools? How do we have pop-up clinics come do cancer screenings or dental care that can move around the state? So I think there's some definite opportunity there. I'm going to call on Dr. Gay, who has his hand raised. So go ahead and come off mute and share your comments.
Thank you. All the comments have been very insightful, and I think one of the things that keeps coming up is the care after something's happened, after getting out of the hospital, after being released from incarceration. I think another focus is preventive, so on the front end. So increasing specialty access and consultations either through the peer-to-peer, like Dr. Zink mentioned, or the e-consult codes, where we can screen whether someone actually needs to come in to see a specialist. So maybe the specialist is not going to go out for a clinic, or maybe the patients, don't all need to fly into Anchorage right away, but you can get a lot of work done and workup done if we can create these, access portals and maybe even affinity groups where providers that are, primary care providers feel supported, where if they want to learn more about pain management, we're connected and say, hey, we're going to have a group that can meet, at whatever leisure you like to talk about topics that are interesting to them and help them manage the patients there and figure out if they really need to use state funds or federal funds or, whatever the cost is or the paying party is to get them into Anchorage for those procedures, whether they need those, and perhaps teach some of the providers out there how to do some of the basic procedures and things that might prevent them needing to come into Anchorage. So cost savings in that manner as well.
Absolutely. I love that. I think there's a there's a portion of that that's educational, there's a portion of that that's connection, and then how do we keep that documentation open so as that patient does transfer or go to other care, how are we able to see all that? So I think all of that is going to be an important part of this. There's a comment in the chat talking about networking, getting out of these silos. Really, primary care is also behavioral health. And how do we connect our tribal partners and our private partners and our hospitals? How do we create that so we're not all operating in these separate systems? And that's really, really where we need to move. And I think everyone knows that's what the future is going to look like. It's how do we get there? So I think it's important that we keep working on problem solving that specifically.
I would just also add, I just want to highlight again the work that's been done. So I see comments about like what Costa Rica's doing. And tomorrow I had put in there like the Help Me Grow program does do a lot of remote outreach and kind of inpatient in home care for kiddos and emphasizing that. I also see some comments like, can we also be thinking again, just as Dr. Gray had mentioned, like prevention? And so want to raise up the comments that had come up earlier about school and as an additional place to access. This came up a lot in the workforce as well as the healthy beginnings conversation that happened up there. So just highlighting those. And if people are not familiar with the community health aides program and the community health practitioners program through the tribal system, I would highly encourage you to look into that when you're thinking about kind of the overall structure, because it's a really, again, unique provider type within the state. So I'm seeing some other conversations where that would just be a good awareness for Alaska if you're not familiar with that already. But back to you, Dr. Rabinowitz.
No, I think that's great. We need some more hands raised. Let's get some conversation going. Would anyone like to raise their hand and kind of share some of their comments from the chat? Alan Choi, I see that you just put a lot of great comments in there. Do you mind speaking a little bit to those? And in the meantime, I'd like to call on Melinda Freeman to unmute and share your thoughts.
Thank you. We provide donated specialty medical, dental, and mental health care to uninsured Alaskans with limited income. And I have heard that perhaps there are conversations about a state-funded health insurance plan beyond Medicaid. So I was wondering if that could be woven into the RHTP endeavors as with the elimination of the premium tax credits for ACA marketplace health insurance and the regulation changes for Medicaid, thousands of Alaskans are currently without health insurance, and it's a major barrier to having people access primary and specialty care. Thank you.
Yeah, Melinda, I really appreciate you kind of highlighting that. I'm going to put in the chat box self-promotion here on Line 1 Your Health Connection. I had a conversation with Deputy Commissioner Ricci about the impact specifically on Alaska on Medicaid, but I'm just going to put that in there as a reference because, again, Alaska is a bit different. But to your component, I think that there is a lot of conversation happening on what does paying for value look like and what does sustainable payment structures look like. And so that might be new licensing type that's needed. That might be infrastructure so that you can see, back to Lisa had put in the chat box, we need shared measures or data. I've seen like comments about dashboards of understanding kind of what are our shared values. Like those are kind of tools that we get towards sustainability and paying for value. But then there's also components of like, how do you make sure that there's coverage and that coverage is really paying for health and helping to really focus on prevention. So while this is one project, the department is working on lots of other things as well as others, including the legislators who are on this call listening and being involved as well and thinking about what those things look like. So invite people to come to the sustainability / pay for value conversation, where we've tried to kind of really do a little bit deeper dive into that specifically. But back to you, Dr. Rubinowitz.
Yeah, and we're going to call on Ramanda Simpson to come off mute and share her thoughts.
Hi, everybody. What I'm seeing in the chat and hearing from everybody who's speaking up, it sounds like there's so much already happening in the state, especially around access to care, that I feel like some things I've never heard of, and I feel like that would be a really good starting point at this stage of the game, that we could, if we could somehow share all of those I'm trying to desperately copy and paste everything in the chat. So I'm hoping that we have an opportunity to kind of bring in, here's what's already happening, here's what's successful, so that we actually understand what's already happening in the state and be able, so that we're not repeating things, or we're able to partner as you guys are trying to do. So just being able to already see what's happening, what's working, and making sure the connections are there for other cities within the state.
Yes, absolutely. And as Dr. Zink mentioned, the Department of Health is working on creating some way that we can share that information. But I think specifically around healthcare access, that's a really good point. As you know, Dr. Zink and I have practiced here for over 20 years in Alaska, and there's things on the chat that I have not heard of before. So it would be nice to have a better understanding of all the different initiatives. And that's part of what these regional in-person meetings will be, as we go out to different communities trying to really figure out what's happening. But I think you're right, it would be nice for other people to have that information.
And Dr. Rubinowitz, to just build on that, feel free to encourage, if people have key resources, feel free to share them in the chat box here. So I see like Zoya is sharing, a couple things in the chat. I also would say that like in the future calls, I think our vision is a little bit more of like a community of practice where we might have 2 or 3 people who are doing great work on that specific topic present on what is really happening there with the resources, and then more of a conversation. So maybe it is primary care, or maybe it's specifically on substance use, since that came up really highlighted, where we have a couple examples of what's happening with a deeper dive into that topic specifically. So trying to give this as a wet teaser to like, this is what's coming, more to come.
And thanks to Tom Baldwin put a comment in the chat. I think we've been talking a lot about access from a different angle, but really back to supporting clinicians, like helping productivity so you can spend more time with your patients is an important part of healthcare access that often we don't talk about in this realm. And so I think some of those, ambient scribes, things like that will help to open up more access for patients as things are streamlined and easier to navigate. And to that end, Kira is also talking about pharmacists being able to do some treatment. So working at the top of your licensing where you're able to help your community in broader ways. And, if you have pharmacy access, you have access to a clinician that can help with some of those treatments. Let's get some more people raising their hand. Dr. Zink, back to you to pull out a few more things from the chat.
Yeah, sounds good. I'll pull up a few more and then we'll kind of show you what her world looks like as we're kind of moving forward and getting you guys to help us think about like what happens next. I do appreciate the comments on like you might have health insurance, but you might not have what it costs for the deductible. And so that is money is literally healthcare access, and we need to think about that. Again, this is where I'll focus on things too, like the Fresh Start program, which was an attempt to make sure that every Alaskan, regardless of their ability to pay, what insurance they had access to key preventative services such as diabetes management, hypertension, weight loss, and dementia. So kind of what are kind of those key services? How do we work with each other to try to make sure that people can afford the healthcare access that they need. And I just want to again lift up a little bit what was said before. I'm seeing again in the chat box, and really, Jonathan, more time with our people. How do we simplify billing? And we have this specifically called out again in that pay for value. Like, how do we pay for the value of the time where people are spending time with each other to promote health? So I, as a clinician, the time that I'm looking you in the eye, listening to your story, thinking about differential for you, and how do I use, like in the technology one we were talking about, like, scribe AI technology to support that, or as Dr. Gray mentioned, be able to consult a service to see if I really need to send them into Anchorage or send them to Seattle or not, so that I've got the tools that I need to be able to serve, and I'm not spending my time billing or trying to get access to the information I need, and empowering that provider-patient relationship, both in and out of the healthcare system to promote health and empower the individual with their health overall. So highlighting that as well. Back to you, Dr. Rubinowitz.
Perfect. And I think we can move on to the next slide. So let's talk about Violet now, because we've all done amazing work in the last 10 minutes and we've expanded healthcare access around our state. So Violet now delivers behavioral healthcare as part of an integrated model. Routine behavioral health screening is embedded in primary care visits, allowing concerns to be identified earlier. Telebehavioral health supports regular follow-up and family engagement between the in-person visits, while shared care plans across providers enable close coordination with primary care and community-based services. Behavioral health is increasingly available and delivered in familiar community-anchored settings, including clinics and schools, reducing stigma and preventing crises. As a result, Violet's work shifts from emergency response towards sustained whole person care that improves outcomes across the lifespan. So I think we can all get behind this model. It's a matter of how we get there, and there's a lot of work to be done. I think, as Dr. Zink mentioned, we're excited to continue this series and do a little bit deeper dives on all aspects of this transformation that we're envisioning. And I think there's a lot of great work being done around Alaska. We've already talked about that. How do we highlight that? How do we dovetail into that and kind of broaden the work we're doing by work that's already out there and functioning well? We can't be afraid to, in systems that aren't working well, re-look at that. So even if we do have a system somewhere in a community, we can look critically at that and say, is this really what this community needs? Let's work together on all of those aspects. So I think there's definitely some exciting things to accomplish together. And next slide. And we can move on to the next slide. Here are some examples, and we've kind of gone through this in a few different ways, but I just wanted to kind of come back to this as we kind of think about what we can add to our next time that we come together. I want everyone to think about what your project looks like, how it could expand, how it could look a little bit differently. So really integrating behavioral health screening in rural primary care settings. We've touched on that a lot today. Telebehavioral health expansion for remote communities. There are challenges to telehealth. We've already talked about those today, but how can we improve that? How can we expand that? What can we do to integrate that to our other primary care? Shared care plans, linking behavioral health, primary care, and community services, really being able to provide the information as a patient transfers from provider to provider, escalating, de-escalating care. What does that look like? Community and school-based behavioral health, really using those anchors in the community as a focal point to provide this needed care. And then integrating crisis prevention and early intervention model. Let's catch things earlier, and that's what primary care is kind of all about. How do we circle around these providers with other ancillary care that may be needed? And next slide. I'm going to throw this over to Dr. Zink for some closing thoughts before we let Commissioner Hedberg close us out for the day. And so back to you, Dr. Zink.
Yeah, thanks so much. I really love this topic and thinking about healthcare access. And so I saw a lot of great ideas in there to have a good system. It has to be built with the workforce that we need, the technology that we need, and the payment mechanisms to do it. But I see this group is really helping to think about what are the systems that we need as a whole. How do we think about, as just put in the chat box, the 911 callers being directed to the services that we need, as others have put in like a multidisciplinary team. How do we empower patients to make sure that we've got that access to care and those other areas and layers? Because actually, like that's what we're trying to get, right? How do we empower individuals with the information and resources they need to be as healthy and well as possible, which is going to take all of these other mechanisms to get there. So really fun kind of partnering and thinking about what this looks like with you all. So with that, over to Commissioner Hedberg.
Great, next slide. Oh, there's a poll.
Oh, we caught you off guard there, Commissioner.
I was ready.
You were ready. We were ready too. Sorry, we snuck another poll in here a little bit later, but what is the number one challenge you want us to tackle as a part of this? So, this is a little bit like we had done before, but recognizing that this was so broad, we had put this in at the bottom, and I saw a lot on primary care in there. If you don't feel like we have recognized what you think is the most important from what we have said, please put it in the chat box. Tell us what you most want to hear about as we develop the future sessions. And go ahead and put those in as Commissioner Hedberg go ahead and closes us out.
We've got one more slide.
Man! Sorry, I'm just ready, Commissioner. I'm ready for you to close it out. You just have such good, thoughtful points in it. There's more sessions coming up. So pay for value, as we mentioned already, happens tomorrow. That is from 10 until 11. These are the ones that have already happened. And so those are recorded. If you want to listen to them, you are welcome to come listen to them. But also, again, we put the pay for value one last because we were a bit struggling with how to go from kind of like, a community health worker to a hospital system to reforming all of Medicaid. Like, how do we kind of base that system? And there is a sustainability part of the rural health transformation dollars that are really critical. So we're going to structure this pay for value and kind of thinking about, like I'd mentioned previously, the building blocks for sustainability and ultimately making sure that every dollar is spent is going towards the health and well-being of Alaskans as efficiently. As I said in a post recently, I've never met anyone who voted for sickness or wasting dollars. So how do we spend our time for health and to use those dollars as effectively as possible? Next slide. Yes. Okay. Now it's Commissioner Hedberg. All you.
Thank you so much, Dr. Zink and Dr. Rubenowitz. I think it was a really great conversation about diving into the purpose of this initiative, which is about access and how we increase access. And it means working differently. So, for everyone, thank you for participating. There is a QR code. You can scan it. It goes to our webpage where you can look at all of the recordings from our prior webinars on the other initiatives, as Dr. Zink had mentioned. Or if you want to read our application or look at the content that went into development of our application, we have been really intentional about our transparency in this entire process because it's going to take all of us working together as we meet the intent, which is to transform our healthcare system for better health outcomes, which means that Alaskans have access and providers have the tools and the technology. Next slide. So if you would like to email us, you are welcome to. I really encourage everyone to email our direct inbox. It is staffed. It's doh.rhtp@alaska.gov versus emailing individuals, which sometimes those emails are super important, but they get buried. So please, if it's related to RHTP, go ahead and shoot us an email. Let us know your thoughts. And you can also sign up for updates. We really have been updating our website a lot, and people want to know when updates are coming. Well, you will know if you sign up for updates there on the website. That concludes this webinar. Thank you so much for participating, and we will see you at the next Impact Series tomorrow, which is on Pay for Value. Take care. Bye, everyone.